Hair thinning out around the hairline and wondering how much roughly for a hair transplant to fix this. I'm 23, have male pattern baldness, and honestly it's just disappointing. It's only in the sides of the top of my head at this point, but I can imagine it's only going to get worse unless I take action, so recommendations on what treatment I should look into and whatever else would be appreciated. Cheers.
Thank you for your question. You're 23 years old. You provided us with a photo of the top of your scalp, and you've described how you're suffering from male pattern hair loss and how disappointed you are, and you're inquiring about solutions that are surgical, and of course you are actually being very smart about being concerned about where your hair loss is going given how old you are. So certainly I can help you from my experience. I'll give you a little bit about my background. I'm a board-certified cosmetic surgeon. I am the founder of a company called Trichostem Hair Regeneration, and we have developed a fairly remarkable solution for male pattern and female pattern hair loss that is non-surgical. And I've been performing hair transplant for many years, and I've been very, very pleased with what we've developed. So I can certainly give you my perspective of how we approach patients like yourself who we see in our practice every day. So to begin with, understanding that male pattern hair loss, especially with the onset at a younger age and the speed in which you're going, you need something to stabilize your hair loss progression. Now, in the United States, we have Minoxidil, which is a topical, which doesn't stop hair loss, doesn't stop progression, but it can prolong the growth cycle of thinning hairs. And then we have Finasteride. Now, Finasteride inhibits an enzyme called 5-alpha reductase, which is responsible for the conversion of testosterone to dihydrotestosterone, commonly referred to as DHT. Now, it really works or helps in slowing down the progression, but it also is limited to people who have DHT-sensitive hair follicles. There are many men who do not respond to finasteride. In the current time, there's a lot of concerns about long-term sexual side effects, which for the majority of patients who come to our practice who are in your age range is a deal breaker. They won't take finasteride. In our practice, we've developed a treatment called hair regeneration. What we have done is systematically come up with a process where a patient with hair thinning like yourself would come in and we combine platelet-rich plasma derived from your own blood and acellular matrix. Acellular matrix is a material used for wound healing. And years ago it was discovered that the wound healing material, when used for transplant surgery to help hair grafts heal and the donor area heal, appear to make thinning hair thicker. So what we have done is created a process and a predictable, consistent response to the point where close to 100% of male pattern hair loss patients do respond and get good results. Now, we have had so many patients over the past several years. We have patients who come to us from all over the world. We've further refined a system, and also we further refined our understanding of who responds with this treatment. Now, it's not the perfect solution. We haven't cured baldness, but the sooner we catch someone, the better the results are. We're treating people as young as 18 years old, and we're seeing very, very good results. There's a small group of patients who have not responded to the treatment. We've retreated them, and they still didn't respond. But as I said, close to 100% of male pattern hair loss patients do respond. Some people benefit from a second injection, which we have seen very nice results with. So it's not a one-size-fits-all. The procedure is customized to the individual patient, and we follow our patients very, very closely. And clearly we exceed the level of commitment and follow-up that we've been able to see from other people who are doing similar types of treatment. Trichostem Hair Regeneration has been our next level of bringing this treatment to patients where they are. And it's been that, which should relate to you, at least communicate that the treatment has been so successful that we've been able to now scale it so that we can predictably have the treatment offered in other areas outside of our 2 locations in Manhattan and Long Island. So I think that this is something that is worth exploring, hair regeneration and not hair transplant. Hair transplant may be an option for you, but without stabilization, I can tell you that patients like yourself who have gotten transplantation, when they come to our practice, let's say they've hit their early to mid-30s, they've only have transplanted hair, but they don't have any of their own native hair, and they still look like they don't have hair, which means they didn't get what they set out to accomplish. So think very critically, keep asking questions, learn more about what I described for you, and I hope that was helpful for you. Thank you for your question.